President Biden is expected to give an update today on Omicron. That's the new COVID-19 variant detected in southern Africa and making its way around the world. Now, the only cases in North America so far are in Canada, but the experts say, look, it's probably here too.
It's likely something that is here at a low level. Delta still continues to be the predominant variant, but I would not be surprised at all to see that Omicron is already here and possibly spreading in small clusters.
Now, to keep those clusters from growing and to have time to do more research, the U.S. is now restricting travel from South Africa and 7 other African nations. Meantime, health experts are closely watching COVID cases after the Thanksgiving holiday. And with that, Dr. Sophia Deben, a board-certified surgeon, health sciences expert, joins us with the latest. Good morning, doctor. What can you tell us about Omicron, including, if I'm saying it correctly? Is it a variant of concern?
Yes, the CDC has listed it a variant of concern, which is one of the now 13 different strains of COVID that have been identified. It is noted to, for now, spread much more easily than the Delta virus. Really encouraging news from Dr. Kutsia. She is the physician that first identified the clinical symptoms associated with Omicron that we know of to date. She picked up the first patient around the 18th of November. And the good news is that the symptoms are much milder and slightly different than the typical COVID-19 set of symptoms.
The travel ban in place from African countries, it is controversial, and some say that's not following the science because, you know, it's already in Canada, it's spreading, likely here. Do you advise Americans to continue to travel abroad this holiday season or stay home?
Travel is once again one of those situations, especially also with the holidays, in which we are not able to maintain the level of social distancing that is ideal. Dr. Fauci very clearly stated on Sunday that the travel bans that are in place are mostly to give us a little bit more time to evaluate this Omicron variant and how it's going to affect us. It gives folks an opportunity to get a booster if it's time for them. It gives folks who perhaps were considering vaccination and are unvaccinated to go ahead and get vaccinated. And it does slow the spread to some extent. I do agree that it is probably going to be identified in the United States in the coming week. And then obviously travel to areas that have a high concentration, which, as you had mentioned earlier, some of those 7 South African countries is probably inadvisable at this moment. I don't believe that these travel bans are going to last for a very long time compared to the first time that we had the COVID pandemic, but it is a prudent move while we are assessing the severity of the Omicron variant.
For those who were relaxed over the holiday weekend, not wearing their masks, not social distancing, what precautions should we continue to practice and exercise until we see these numbers go down drastically and until we learn more about Omicron?
Well, once again, trying to maintain the social distancing, keeping our social gatherings to less than 10 people, wearing our masks when we are out in public in an confined space, such as a grocery store or a restaurant. And really, Dr. Fauci is really encouraging us. And I think we're going to hear a lot more this week about using the booster shots perhaps a bit more aggressively than was initially considered as a means of precaution. Once again, the Omicron variant has a very mild set of symptoms, and it may also be something that spreads through the unvaccinated community that will improve our herd immunity as a group of human beings on this planet that thankfully will perhaps not cause the severity of disease that we have seen with several of the other variants.
Despite you and others in the medical community urging us to get the vaccine, and the push continues along with the push for boosters, still an estimated 82 million Americans are not doing that. Talk about the importance of vaccines and how much of a difference boosters can and do make.
We know that the current, and I'm going to use just some general numbers, the current Moderna and Pfizer vaccines have an efficacy or an appropriate immunogenicity in the sense that in about 90% of people who have received both of the initial injections have about 90% immunity, which means there's about 10 to 15% of fully vaccinated people who are susceptible to the disease. And then we also know that if you are unvaccinated, you remain more susceptible not only just to transmission, but to severity. We are in a new era of diseases. They are viral, and our vaccines are not necessarily preventing disease. What they are doing is minimizing. So if you do get COVID or you get it a second time, it'll feel more like a cold or a flu and not necessarily put you on a ventilator in the ICU. Number one, causing the direct medical concerns for you, but also burdening an already stressed healthcare system. So vaccination really is a twofold benefit for us.
Yeah, it's not just the weak, the elderly. I mean, we're having pro athletes saying that they thought they would die upon getting COVID. So this is advice that I hope more and more will heed. Doctor, thank you.